The title of this PowerPoint is Healthcare Challenges. This is a quick outline of all the information that will be discussed. The electronic health record is an important part of any hospital or healthcare organization setting. There are strengths and weaknesses to the implementation that are important to discuss. Three main challenges are inoperability, usability, and health IT safety. Each face their own challenge, and a few researchers have come up with a recommendation about proper implementation into the EHR. The electronic health record is an electronic version of the patient's medical history that is maintained by a provider over time. This may include all of the key administrative clinical data relevant to that person's care. Hospital studies are slowly implementing EHR because if implemented wrong, it can increase the risk of medical errors. Errors can lead to malpractice lawsuits and other legal complications. There are strengths and weaknesses of the EHR. A few strengths include improving clinical, organizational, and societal outcomes. Clinical outcomes improve the quality of care. Organizational outcomes can include financial and operational benefits, and societal outcomes include improved population health and reduction in cost. Weaknesses of the EHR or challenges are inoperability, usability, and health IT safety. These three challenges will be discussed in greater length on the next slides. Inoperable electronic health records allow the electronic sharing of patient information between different EHR systems and healthcare providers. This helps providers easily look up patients' information and medical history after they leave a facility or go to a new one. The challenges with inoperability is that it is a complex system and there is a lack of industry collaboration. There are many types of EHR systems and may use different interfaces, technological specifications, and capabilities, which can make it hard to read and transfer data between two EHR systems. Industry collaboration is another challenge of inoperability. Some aspects of EHRs are poorly designed and therefore cause physicians to spend half the time entering data and handling administrative tasks. Usability is the effectiveness, efficiency, and satisfaction with which specific users can achieve a specific set of tasks in a particular environment. One reason EHR usability may be poor is because of the user-centered design and the way it is implemented into the EHR. User-centered design is defined as any approach to design that integrates extensive information about the people who will use the product into each stage of the design process. There are three types of UCD processes: well-developed, basic, and misconceptions, and they all have their challenges during implementation. For example, the misconception of UCD needs leadership, support, and investment in resources and knowledgeable staff, and there is no leadership or knowledgeable staff support. The UCD can be implemented incorrectly and can cause poor usability. Health IT is health information technology, and it is used by doctors, nurses, and other healthcare professionals for the population health management, analytics, information sharing, and precision medicine. Excuse me. It has become increasingly difficult to measure health IT-related adverse events, near misses, and unsafe conditions because it is hard to identify and separate technical and non-technical factors. One example given by Singh and Siding is that a system interface between a medication order entry module and a pharmacy inventory management system. If the physician ordering the medication does not realize something is wrong, the pharmacist will fill the order that is not for the correct specific patient. There are three levels of inoperability: foundational, structural, and semantic. Foundational is one EHR system can receive data from another system but does not need to be able to interpret it. Structural is the data can be exchanged between information technology systems and interpreted at the data field level. Semantic is where two or more systems can exchange the information. The information exchange can be used. Because there are three levels, it makes it difficult to create one standard of inoperability format for sharing. If hospitals and other organizations are going to utilize EHR, there does not need to be three different levels, instead just one. That way data can be shared from physician to physician. There are 9 principles of usability that can be applied to the development and evaluation of the EHR system: simplicity, naturalness, consistency, forgiveness, feedback, effective use of language, efficient interactives, effective information presentation, preservation of context, and minimal cognitive load. It is recommended for the EHR being evaluated using all these concepts in order to make sure that their usability is high. For example, when testing the consistency, all the parts of the application need to look the same and feel the same on every screen, rather than having data stream randomly. The electronic health record plays a large role in patient quality, care, and safety. However, there are still a few challenges that need to be addressed and overcome. Interoperability, usability, and health IC safety are three main challenges that have a large effect on patient quality, care, and safety. These recommendations to overcome these challenges are making interoperability simpler and testing usability and safety. I hope you learned a little more about the challenges EHR faced during implementation.